back to Village in Motion this Tuesday, October 16th. I'm Clint Lambert. And for this segment of Village in Motion today, we have two people from Home Support. We have Krista Morrison, who is the Home Support Manager, and she brought a new employee with her by the name of Hana. And we're very glad to have both of you with us.
Thank you for inviting us.
What goes on in Home Support?
Well, we have a new position, and that's what we want to talk about today. In Home Support, we have a brand new position. It's called Home Care Worker. Okay. So it's very much like the CNA position, except Hana's not certified and she's not licensed. But the other Erickson Living Communities also have been hiring home care workers along with the CNAs.
Okay, wonderful.
Okay.
So does that mean then, as a home care worker, then you would actually do cleaning, or what would you do as a home care worker? Or what do you do as a home care worker?
Sure. We do pretty much like cleaning and still help them with activity of daily living, but we don't do something which requires a license for us to do that, to help them. Like transferring, that's a full risk. So we don't want to take that risk because we don't have a license from the board.
Okay.
And they also don't do medication reminders. On clients that need assistance with medications, she would be unable to see them. Also, the client needs to be able to direct their own care, so there can't be any sort of dementia or memory issues, or a spouse that can direct the care. Okay. But she can, assist with the bathing and dressing. Everything pretty much a CNA does, except more skilled. If there's wounds, or even with the wounds, a lot of the CNAs can't do they can do certain things, such as reinforce the bandage. But outside that scope, it's mainly the skilled stuff. A lot of our clients don't need a lot of skilled stuff in home support, but you are working independent living. So the qualifications for a home care worker is they have to have a high school education. And they need to make sure, the qualification is 1 year of working with the elderly. Okay. So the challenges that Hana and I have had, and as well as Sana, is that when she's the very first one, and we've only hired two other ones, so a whole bunch of new lists have to be made. So even the process in the office has changed somewhat. From day one, when Sana and I were pretty much began to interview, we were having difficulty of saying, it's not a lot. 1 year with the elderly means what? So when someone comes in and says they've been taking care of their grandmother in the last year, is that enough experience to be working in an independent living?
And what does that really mean? What have they really done?
Right. And they are meeting the qualifications, working with the elderly, but we have such a wide variety of diseases and conditions that we've tried to, we first weren't hiring them, and it's like, let's make it some parameters for ourselves. So due to the community in which we're living.
Hana, does somebody supervise you? Are you out there all by yourself, or do you get support?
Pretty much independent, but if something comes up, I will call the supervisors because I'm always work under the nurse supervision.
Okay. So you would have a nurse supervisor then?
All the time, yes.
All right. Okay. What if a resident wants more than one home health care, what do you call it? Home support?
Home care worker?
Home care worker, thank you. Can they have more than one?
You mean more than one at one time, or just multiple?
Multiple.
Yes, they can. Hana has, we were just talking about her availability. She needs to stretch it out because everyone loves Hana. It's interesting to watch, but she only works, she works every weekend, which is a lot, and every Tuesday.
Oh, okay. And we have one other home care worker?
And she's working 7 to 3. And then we have, I think we have a third one that works 3 to 11, and they do have a little more availability. But as those admissions come in, the nurses are screening them and putting certain things on them, say, home care worker can see them.
Oh, very good.
So it is a new process. So we're very happy to have it.
What's our charge for that?
It's the same charge. is for a CNA.
Oh, okay.
It's for 1 hour service or 4 hours, or whatever they need.
So you can get 1 hour, 4 hours, or more.
Right, as long as they don't need medication reminders, because usually the longer a service usually means medication reminders.
Oh, okay.
It usually does.
All right.
Usually does,
Okay.
unless the family's involved.
The reason I was wondering, and my wife and I, we have a large apartment, and we have a housekeeping person every 2 weeks who spends 2 hours. I mean, she works continually for those 2 hours.
Right.
I mean, nonstop type of situation. And I was just wondering, the amount of work is just phenomenal to me that she does.
Right, right. Well, housekeeping is part of what she does, but along with the bathing, the dressing, and meal preparation. If the client needs to take walks out and about, picking up their mail or assisting with that, or picking up dinner at the Potomac, those sorts of things, also she's able to do. We do still have the companion service, but we only have a couple of them left, and they are no hands-on. So they mainly are the housekeeping and picking up packages and doing those sorts of things.
So we have companion, we have home care, and anyone else?
The CNA.
And the CNA. Wow. So we got plenty of.
So we're branching out.
Yes.
And we want them all to be like Hana.
Yes.
Sweet.
Well, Hana has such a beautiful smile and such a great,
thank you.
personality, and it's just very. Hana, you started to tell me you are from
Ethiopia.
Ethiopia.
Originally, yes.
Oh, okay. And how long have you been in the States?
9 years now.
9 years.
Yeah.
All right. Very good. And where were you working before you came here?
Well, before I came here, I worked for a wholesale. So they call it restaurant depot. I worked there. I started as a cashier, then I became assistant, HR assistant.
Oh, very good.
Yeah, so then I decided to go to school for a nursing program. So the schedule wasn't fit for me. So I had to stop working there.
Yeah.
So I started going to school and I took the CNA courses. So usually I go, that's a home care. So I go to the resident's house and I do some stuff and I get a chance to sit down and study. So I got my associate degree in general science from Nova.
Wonderful.
So now I'm on the transition of nursing program.
Very good.
Yeah.
Well, we wish you well.
Thank you.
Yeah, in regards to everything. Very good. And Krista, is there anything else going on in home support?
We're getting ready for the Ensley Health Forum. That is going to be next Wednesday, the 24th. So we're getting ready for that. That was a big hit last year with the community. A lot of people really attended. We were very happy with the turnout. So that is next Wednesday. I'll put a plug in for it, 1:30 to 3:30.
So Wednesday the 24th. Okay.
The first session is 1:30 to 3:30, and the second session is 7 p.m. to 9 p.m.
Okay.
So that sons and daughters can attend with family members.
And what will be
needed.
discussed?
And it'll be 4 departments, but they're all pretty much under resident life. It's the home health department, a home support department, not resident life, outpatient rehab, along with intermissions.
Oh, okay.
So that's a little twist, because
Yes.
last year we just had we had 3 departments with hospice. So this year we kind of wanted to include some other departments, as well as social workers. Social workers will be attending and talking as well.
Okay. We do not have hospice anymore, right?
Correct.
And so if someone needs
don't.
hospice, what happens?
Lots of times it is their choice of which hospice they want to be directed to. We get that question quite a lot. Actually, we just got it at some point over the weekend saying, who do you prefer? We don't give them a list, but we do verbalize, give them a list. We can tell them who works here on campus, and et cetera. So it's still an easy transition.
Okay, very, very good. With all this material that you've got, what can residents do to help you guys? What should we do if we need assistance?
Mainly just reach out to us, and we will always be able to assist. We do have difficulty right now in the morning hours, so we've been reaching out to other people to assist us with this. Just a lot of people want the morning hours right now, and the biggest portion of our business morning hours. But it's fine. We want people to reach out, and then we'll make the proper referrals if we need to, or if the nurse goes out and assess them, and a home care worker, because we still have quite a lot of business, not only Hana, but her two other people working with them, they still have some open slots.
Oh, okay.
So reaching out, as far as the residents, what I would really say is we have difficulty sometimes with cancellations. They forget, and at the last minute they cancel, which it's a disadvantage to them because they have to pay for the service if it's not done timely. And the second thing is if they cancel a Friday for a Saturday and Sunday, that can really play havoc with the schedule.
Right.
So that's difficult. And so we've been trying to get that message out that as soon as you know you need to cancel, or as soon as you know your daughter or son's coming over and you need to cancel, let us know.
Okay. So that's very, very important.
It's very, very important. And it's nice to have those things done during business hours.
Right.
Lots of times residents will call in the evening hours or on Saturday for Sunday, and we've been doing that re-education with them to please try to call in the office between the hours of 8:30 and 5 for those cancellations.
And what number is that?
That's 703-923-4677.
4677. And you guys are located downstairs in
Forest View, the terrace level.
Okay. And if somebody wants to say hello, they just need to walk down and say hi?
Absolutely. And we have a lot of clients will come down and find us, sons and daughters will come down. I say find us because sometimes it's a challenge. But yes, we're there. And we like when they come visit because, it begins that rapport and relationship.
Right. Okay. Do you give a report back to whoever who's paying for the service of what's going on and any progress or whatever?
Sons and daughters will call a lot, and they will question, how's my mom doing, especially if they're in 24-hour service for a couple days or a couple weeks, and they see that their mother or father's getting stronger. They were thinking about decreasing service, and that's a lot of the information and feedback we give to see would they be safe alone getting up and not having our service. So Sana and I just call around to the different night aides and get their feedback and give that usually to them and the social workers so they can make those decisions.
Okay.
Yeah.
Do individuals who have a home care support, do they typically progress to home health and needing someone from that level?
Usually, if they have home support, lots of times we get them at the same time because they've come from Garden Ridge most of the time, or they've come out of the emergency room. If they need home support because they need that skilled component.
Okay.
Otherwise, it's custodial care that we do, and that's how Medicare looks at it, and that's why there's no reimbursement for our service. But it could be that somebody's just weaker and really don't need the skilled care, so we do have probably a big portion of our service of population is that sort.
All right.
People just feeling sick. The flu season hopefully won't be as bad as last year. We had a lot of service going
Well, I heard yesterday, the report was made yesterday that they have given flu shots to about 1,300 of us.
Oh, wow. Okay.
Which
that's a good.
came out of the clinic, because the clinic's report yesterday at Coffee with the Exec. So,
oh, that's great. That's
which
good.
I thought was outstanding.
It is for this time of year. That's really good.
So hopefully we're ahead of the curve, and everybody who hasn't gotten a flu shot will get one.
Right.
In regards to it. But what I'm hearing is if you need help, you've got it.
Yeah, reach out to us.
Okay.
Exactly. We do our best. And we do 24-hour service. I shouldn't say right on the spot, but usually within 4 hours we're able to get someone out there. We just got a call right when I came up here, so busily we are trying to work on that.
Sounds great.
Yep.
And you have enough staff?
We do not.
Oh, you do not have enough staff?
We do not have enough staff, but we're working on it, and one of the ways the Erickson Living is looking at it, in hiring the CNAs, they're having problems everywhere. It's just not this community, and it's just not Erickson Living. It's the hospitals, it's assisted livings, a whole bunch of different facilities are having the same problem. And I think maybe the CNAs are all going back to school, or they elect not to be a CNA, and they start out being the LPN, or an RN. Okay. So we are still really doing, we've done 2 job fairs. We did one last week, and we probably hired pretty evenly the CNAs as well as the home care workers.
Sounds great. Well, thank you very much for coming, Krista, and for bringing Hana.
Mm-hmm.
And Hana, welcome. We're glad to have you. Keep up the great work and keep that beautiful smile.
All right,
okay?
thank you.
All right. Thank you.
Thank you.
Okay.